Now to Fiji, where an HIV outbreak has been declared. There were more than 1,000 cases recorded between January and September last year, and there were 115 HIV-related deaths in the same period. Health officials say there are alarming trends in transmission among young people and injecting drug users in the Pacific nation. Dr. Alipate Vakamocea is the president of the Fiji Medical Association. He says it's crucial that the government finally declared an outbreak.
The Fiji Medical Association has actually been kicking up a little bit of a fuss about this since late last year. In fact, we went live with the media to basically petition the government to call an outbreak because I think by late last year, we knew that we had already defined an outbreak in the country. And I think the ministry has just done that about 5 days ago. And so obviously, once you've declared an outbreak, then you can take the extraordinary measures that are necessary to start to control or to address some of the issues. Yeah.
Yes.
So they finally declared an outbreak. Yeah.
Yes. And what's behind the recent rise in HIV cases in Fiji?
Yeah, good. So we know from the statistics that have been fed back to us by our doctors on the ground that probably about more than 50% of the cases, the current cases that are responsible for the spike this year were IV drug users. So the drug epidemic has reached epidemic proportions in Fiji, and this is now being shown through our HIV status. Yeah.
Yes, and are we expecting case numbers to grow significantly? And also, would there be wider concerns for the Pacific region?
Yeah, absolutely. We're now looking at we're backtracking. We've got about, I think the ministry announced about 1,000, less than 100 cases, 1,100. We're definitely much more than that. In fact, there's some suggestions that we're probably 2 or 3 times higher than that. And we're also seeing the impacts of the HIV epidemic in our children. So we had about 19 cases of HIV in children, newborns and like 3 months, 4 months of age, just in 1 year alone. So that's significant, basically system failure for HIV prevention and control. So that's quite staggering. Yeah.
Yes, and why do you believe that you've got different numbers from that of the official figures from the government?
Well, it's a bit of a process, a bureaucratic process. We get information directly from our doctors on the ground, and as the information feeds up to the ministry, there's lots of bottlenecks and things like that, which is why the declaration of the outbreak was so late. But as we know in healthcare, when you have delays, that just basically increases the mortality and morbidity. Yeah?
Now, Fiji's health minister says that HIV is evolving faster than currently what their services can cater for. So what are Fiji's shortfalls when it comes to providing treatment to those who have the disease?
Well, so basically, from the ministry side, our system was set up to handle HIV cases. We were never designed to handle a surge, especially with, like I said, the influx of these IV drug users. So we don't have anything to handle to manage the issue with the IV drug users. So that's why we need to declare the outbreak quickly, which we have done. The next step, again, is taking along to evolve, which is the emergency plan. Now, the ministry have spoken about a 90-day plan. We haven't seen anything in terms of that particular action plan. So we don't know what's happening on the ground at the moment.
And is the public getting the messages there for caution to stop the spread of HIV throughout the country?
I think the messaging has been quite clear. It's been going out. We've got religious groups getting involved. There was a New Year's message recently. The message is getting out there. But the issue is our IV drug crisis. We have nothing to address that at the moment. And unless we're going to start targeting those particular risk groups, we're going to continue to see the rise, unfortunately.
Yes, and in the immediate short term, what do medical practitioners and authorities have to do to contain this outbreak?
I think there's some strategies that we could start looking into, and these ones have been tried and proven overseas, like maybe get a needle exchange program going, We probably need to look at using PrEP as for our high-risk populations, and maybe being a bit more proactive. Like, for example, in the antenatal clinic, if we take history and we find out that the mom is an IV drug user, or the partner is an IV drug user, we might as well start them on PrEP, because the last thing we want to see is our babies turning positive.
Yes.
So there's quite a few things that we can do. Yeah.
Yes, and I also wanted to read to you a statement from the WHO, which is expressing quite deep concerns about the implications of the US government's immediate funding pause for HIV programs in low and middle income countries. Will this have major implications for Fiji and the Pacific?
Yeah, I think so. I haven't seen, like I said, I haven't seen the 90-day emergency plan that the ministry has come up with, but I would like to think that it contains things like, support from American CDC, for example. We don't have the expertise, in the region, and that's probably an area that America can start helping us out with. So this freeze by the American presidency on support outside America is going to hurt us. Yeah.
Yes, okay, Dr. Alipate Vakamocea, we really wish you well with all the work that you're doing, and thank you very much for speaking with us.
Thank you very much.